Well,
One woman wanted 20 of them for the guests at her garden wedding to sleep in.
Oh.
So you put up folks for the garden wedding.
That's a good idea. Then you don't have to have them in the house.
That's right.
Brilliant. Let's get out to Tasha.
Touching her things.
Having to feed them and find out how she's doing. Tasha.
Well, I'm going to get my eyes checked and now and find out how the health of my eye is doing. So, Dr. Sexsmith, you got your little head contraption. Now, what are you looking for now with that?
Well, with this instrument, we use it to look through the pupil into the back of the eye back here to check the posterior part of the eye. Mm-hmm. Usually we put drops in the eye to make the pupil large, so it gives me a much better view overall. I can see without the drops, though.
Okay.
Yeah, so we would just hold, I would have you look straight ahead, and I just hold this lens up to your eye, and I look through your pupil, and it gives me a really beautiful view inside your eye. It's a three-dimensional view, so I can see bumps and different surface irregularities. So I would examine both eyes with this to see the back. So I'm checking for glaucoma, I'm checking for retinal detachments, blood vessels breaking, eye diseases like that.
And what's the most common thing that you usually find in people's eyes?
Well, the most common diseases in the eye are diseases related to age to a certain degree, but glaucoma can happen at any age, but cataracts are very common as we age, and so is macular degeneration. It's a very common cause of blindness in North America. It's the most common cause.
Now, what exactly is glaucoma?
Well, glaucoma is a condition where there's a high pressure in the eye, so this muscle here produces fluid that flows out through the pupil and drains in the front of the eye, and what can happen is you can have poor drainage, and so it's like pumping air into a balloon. It gets tighter basically, and so the pressure inside goes up, and then the blood vessels have trouble pushing blood through, and then the nerve tissue dies off. So it's a treatable condition. We can put drops in to make the pressure go down so the blood flows better.
And what about cataracts?
Cataracts are where the lens in the eye becomes very cloudy, and that happens just with time. Sometimes UV exposure can accelerate that, or certain diseases like diabetes can accelerate that process. But so what happens is the light doesn't pass through the eye very well and form a clear image, so we can take the lens out and put a false lens in.
Oh, just like that.
Very simple. We have cataract specialists in the city. They're fantastic, so it's a very simple procedure and easy to do. Yeah. Well,
okay.
Easy to do.
Now, other ways to check my eye health is with that machine, though.
Yeah, so to look at the front structures of the eye, at the front, the cornea and so on, we use this microscope. So I would just have you come forward and you just put your chin in there. And then we look with a light. It gives me a lot of magnification. Just look straight ahead. And I can check the structures at the front of your eye. So, and I can also look actually through your pupil. I can hold this lens up and look through it at the back as well.
Oh, wow.
And it gives me, again, it's a three-dimensional view because both eyes, I'm using both eyes, and gives me really lots of magnification inside at the back of your eye.
Now, do a lot of people have eye disease and they don't even know it?
Well, not a lot of people have eye disease, but yeah, you can have eye disease and not know it for sure. For especially glaucoma. There's no symptoms. There's no symptoms basically until you go blind, unfortunately, with that one. So that's a really important one to be checked routinely to make sure that you don't have it, especially if you have family history. Okay. Or if you have diabetes.
So always look into that.
Yeah.
Thank you very much. And my eye health is okay?
Yes, it looks excellent.
Perfect. Let's head now back to the station with Simi.
All right, thank you very much for that, Tasha. It's not that hard to eat healthy. I know we always say that, but it's true, and Erin Holm is here this morning to teach.